Welcome to another episode of the Untold Podcast, where we tell the stories of founders and funders and how they arrived at this particular point in their careers. Today, I have a wonderful guy by the name of Justin Chan. I'm going to let him do the intro on himself, but it's a quick snapshot of the things that he's going to be embarrassed about saying. So 30 under 30s, Forbes magazine. We're going to ask him a little bit about how he got there. Cambridge graduate, and his startup called Gense, little over 5 years ago, is now has now just cleared a pre-A round, and they have a piece of technology that is looking to revolutionize how medical diagnostics is done in a more decentralized and possibly remote healthcare situations. Justin.
Hi.
Thank you for coming.
No, thanks for having me.
Yeah, I know it's a very cold day outside.
It is. You're on t-shirt.
I'm wearing a t-shirt. It's warm in here. That's what I keep telling people. Tell us a little bit more about, yourself and how you got here.
Sure. So I was always focused on impacts. Like I tried a couple of things before I eventually landed on Gense. It's always about how we can make real innovation to help people. And it was very organic. We met a couple of friends. We started with this idea about a technology called EIT. And then we just organically grew from there to see what makes the most impact. So it went from something with an idea that we have something medical being well understood for a number of decades to something that we can put it from the end stage patient to something very, very early stage. And we grew the team from there. We got more supporters from there. We got more clients. And that's a very organic sense of how we got here.
Mm. We'll get more into that technology in a second. But earlier you were telling me you were working on two startups at the same time, right? And on one of them, you were doing something quite interesting.
Yeah, so we were with the Myanmar government, the one that was the past one before the coup, and it was just opening up that country, and we went in to help the government issue government bonds that could build up small infrastructures like water, electricity on village level, and it was quite interesting. We got a Forbes 30 under 30 of that. So we get to meet a lot of interesting characters. We met Obama, quite a few people from that as well. And we started making an impact. And obviously there are challenges as well. COVID hit, and then there's a coup as well. So it's something that was a very interesting part that we did make some impact, and then we're hoping to go back to eventually.
So it sounds to me you like to take big problems and then bring it closer to how it's more usable to people, right? I'm seeing a theme here.
Yeah, no, I think those are the problems that are worth solving, because if you iterate, you can still solve a big part of it. You start with something big. And I think that's where most effort could go into. When you have real innovation, then you can make sure it's a lot more scalable. And it's something that I would feel worth the time going into as well, because we would like to think of ourselves as innovators, and if you do want to innovate, it's good to have a space that you can actually make this useful to most people. So start with big ones, and then it will make sense down the line.
So tell me a little bit about the problem you're trying to solve with Gense. What's the issue?
It's accessibility. So it's just healthcare. I think even before COVID, we see strong sense of medical system is always overburdened. Before COVID, everywhere in the world, when you have public healthcare system, the wait is like a couple of years. It's not abnormal for non-urgent patients. And you always see cases where people get disease notification or they found out quite late. And then there's a lot less they can do about this. And a part of it is down to checkups being not frequent enough. It's not early diagnostic enough. And then there's just no risk factor that you can look at. And that's where we're trying to get in. We're trying to help with making something very affordable, very convenient for you to get tested quarterly, every half a year, or even sooner. And it has to be convenient enough that we can bring it to your home, bring it to your offices, bring it to places in elderly homes, community centers, that not even requiring nurses or highly trained medical professionals to do it. And that's how we can help with the scalability and help with the accessibility of it.
So let's just flash the device up on screen here, and then maybe you can talk us through a little bit about what the device does.
Sure. So the device is essentially something that's palm-sized, and it connects to two things. It connects to the internet, where we do all the cloud computing there, which feeds back to the tablet for service provider to actually do the test and look at results. That's one side. The other side, we have a belt that we essentially wear around the body part that we want to scan. So if it's lungs, we wear it lower chest, and then liver just above the bottom of the rib cage, and kidney a bit lower. And it's essentially a 1-minute scan. We look at the electrical properties of organs, and based on that, we can tell, for example, the severity of a fatty liver tissue and the abundance of it. Similarly for kidney damages, and some of that as well. And we benchmark all of this with medical standards, so that it's something that could be understood and used by medical professionals as well, but at the same time layman enough for people to follow up with the reports that we have, with advices that we have, and generally looking at how we can reduce risk sector and improve the health as well.
Okay, so you're published as well, right? So this is published research. It's not some shady thing that, some shady algorithm that, no one understands. This is proven tech.
Yes. So that's a big part of the development process that we really try to get right. And we do have 10 professor partners just in Hong Kong. We have more overseas as well. And we publish with them. They put their names on the paper as well. And we use their patients. They help us go through some of the clinical trials. And we're publishing Nature scientific reports and top journals internationally as well. So those are online.
So from an innovation standpoint, I feel like you're at the beginning of a disruptive cycle almost. When classic Hayden Christensen disruptive innovation, you take the giant supercomputer that occupies an entire floor of a university or an entire building, shrink it into a floor, shrink it into one rack, shrink it into a home PC, shrink it into now a watch. Yeah. So is that? Do you think there's a trajectory like that you're on at the moment? You've gone from very heavy industrial, next to the bed end stage care device to something that fits in the size of your hand.
Yeah, no, it's certainly it's that as well. So smaller size, more convenient. It's definitely a trend. And then there's also one big trend I think medically it's very important is to policy support as well. So we do see the beginning of a trend that the policy makers are not just talking about it. We're really trying to make something happen now. And that's quite important, I think, with the push of COVID, with the openness of private sector players that are more adaptive to digital changes. And that's what we see a beginning of that change as well, because medical industry inherently, and they should be quite conservative. So with everything going on, there's a big push towards making that change. And on a policy level, on primary care level, that we do need to do a lot more in this space.
Our whole healthcare system seems to be geared towards curing rather than preventing.
Yeah, curing is always one big part because that's the dramatic point, right? Yeah. You cure a person and then it's basically a big life-changing event. But preventive, it's certainly one big side. That even with our generation, we're seeing a lot of things going on in here, especially COVID as well. People are a lot more health conscious. So preventive is certainly one way that we will see the growth of market.
To me, this sounds like a no-brainer. Okay, but, as we know, there are so many startups out there that have no-brainers, and yet they still can't commercialize. They still can't get to market. What's the biggest hurdle you've had in this whole process? Has it been the regulators? Has it been what has it been?
Throughout the journey, there are things that we do need help with, like hiring, like financing. We close our investment round with our grants. But one part that was really quite a big struggle, especially with medtech, where we need quite a lot of R&D, would be the cash flow upfront. So we had, luckily, quite a few grants coming in from the government, from the start, and it's been sort of slowly increasing. But part of the system's requirement is that you do need 12 to 24 months, even more, for reimbursement. So there are times that we do have to somehow find the money and pay people first, or before we can get things back in. So there was a good year or more that aggregate in my account and the company account, we have like a couple $100 Hong Kong throughout that process.
Believe me, there's a lot of people listening who can empathize with that.
Yeah, but yeah, it works out. And if you go through that period, and you basically survive one big part that makes your work a lot more defensible in that sense.
So I have two comments on that. First comment is, you either, looking at that, you either have balls of steel or laser-focused vision. Which one is it?
You don't really have a choice at that point. I basically jump into startups. I always knew if I go into corporate, eventually I'll be miserable enough to start my own thing as well. So why not start early when the opportunity cost is a bit lower? You don't have to, worry about family or the responsibility as much. So it's really a dive into this, and we have to succeed. So that brings us that focus. And basically, when you don't have a choice, it would work out. It's more of that.
Yeah. Well, I think for some people, it's you don't have a choice. For other people, they would say, "Oh, I could just give up, right, and I could go to a cushy consultancy and do a consultancy job."
Well, it's something that whether you enjoy doing as well. So there's always a backup pathway with our team's education background. There are a lot of things that we could do. But at the same time, whether you would be making as much of an impact, whether you would be creating something of value that you can call your own, whether you can dictate the terms on how you drive innovation and have that satisfaction when it actually happens. It's not something that you might get as much in job. And that's, I think, that unites the team a lot on in that aspect. And that's probably one of the main reasons we're still sticking with this.
So this technology has been around for a while. What was the trigger point where in society at large that makes this solution relevant today?
So the entire system with COVID is sort of a wake-up call that we do need to push a lot more into this. And there's a sense of survival from both the public and private sector side that we really do need to do something. And there's a real act on this rather than just talk to go make this happen.
So, you're in Hong Kong at the moment, right? Where to next? Are these the types of things you're looking at?
Yeah, no. So emerging markets, US, definitely something that we do need to tackle. Right now, we're in Hong Kong because we're based here. But at the same time, the next step really is to build up that confidence. It's a very new technology. So we're going for countries that have respectable healthcare system in Western parts of the world that we can deploy. But at the same time, with that, there are a lot of groundwork that we can already start doing in emerging markets, because this is something that's a lot more scalable and a lot more affordable as well. And it makes sense for us to go there. So it's definitely sort of after we have that confidence built up, we can simultaneously start building those. US is something very interesting. So on a logical side, we really should go in. And because it's expensive, there are a lot of healthcare problems that we could solve with early detection there. And if we go to traditionally non-medical focused players, there will be a lot of opportunities. When we do go to medical players, there are sometimes considerations on whether this is expensive enough and whether they would make a big enough cut to justify going in. So that's really an interesting part on how we should tackle the system and sort of align all the interests as well, because it's important in everywhere.
It's wild. That's a wild answer. Like for not. It's like we're not going to adopt this technology because it's too cheap.
Well, yes, that's feedback that we do get from time to time.
So are there opportunities to look at? Obviously, your New Yorks and San Francisco's, their doctors will want lots and lots of money to deploy this. But what about remote regions in the US? Like, do you see that if there's a Walmart there, or if there's like a Walgreens, or and they don't have all of this other imaging technology nearby? Is it a case to deploy it there? Is it a government kind of purchase that out at these locations?
It could be both. It could be a private sector, it could be public sector play. But the main thing with every country, every medical system, is that it has to be complementary. So we're not trying to take people's money off the table, take away their revenue. So this is one part that we could complement the system. So telemedicine has been talked about for a long time, and then in not so remote places, like even suburbs, to get access to medical equipment, it takes hours of drive sometimes.
Yeah.
And having something that can be deployed locally, that could give you some early indication really just by your doorstep, is already a big part that could help the system. It could be seen as a funnel to other channels within the medical system. And obviously it helps the well-being for people as well. And it's not necessarily competing with existing sort of players, and that's one big part that we do see how we can complement into this. And obviously, there's always a big government play for public healthcare system where you catch it early, you spend a lot less in treating them.
This last question is an open-ended question we ask all founders, and it goes back to our vision discussion right at the beginning.
Yeah.
So, if there was one thing that you're hoping to change about the future of the industry, what is it?
It has to be accessibility. It has to do with early detection. It has to do with how do you monitor chronic diseases. Because a lot of things are really preventable if you catch it early. And a lot of reasons why people are not catching this early could simply be down to the cost of it, convenience of it. I've seen people who just don't want to get checked up because they don't want to go to clinics. All of those, and whether you can even do this outside of clinics, whether you have community centers, all of it, so that it's a lot more accessible, whether it's home or not. It would be a big part of promoting that preventive aspect of things. And if you do have disease, unfortunately, how can you catch it when it deteriorates really early as well, so that you can prevent it? So all of those boils down to how early you can detect this, and it's about accessibility of things. And that's where I see the sector going into next steps.
Justin, great talking to you.
Yeah.
And thank you very much for coming past our very chilly studio today.
No, thanks for having me.
We're going to keep an eye on your progress, and we wish you all the best.
Thank you. Thank you very much.
Thank you, everyone.